Hi, my name is Jennifer Steverson, and I'll be providing pain management teaching for the patient that we saw in the simulation video. I think it's important to first establish what kind of pain the patient is having. Are they having pain from a vaginal birth, a cesarean? Are they having pain while attempting to breastfeed? Did they tear during a vaginal birth, or do they have a hemorrhoid from the pushing of the birth? So the first step is to identify what type of pain the patient is having and have the patient rate their pain from 1 to 10. Because we are given discharge instructions to this patient and they are going to be sent home with Motrin, I think it's safe to assume that they don't need anything higher, but also tell them that they can alternate their Motrin. They can alternate Motrin and Tylenol and ibuprofen. And that would give them additional pain coverage if they can't make it the 6 hours between Motrin doses. Another thing, from the uterine contractions potentially causing pain, they could be advised to use a heating pad on her abdomen, or position them for comfort, find a position that's comfortable for them, and tell them to use pillows or sit up if they need to provide that comfort from the uterine contractions. If they're having breastfeeding pain, you could always consult a lactation consultant, because improper latching could cause the nipples to be sore. If they aren't breastfeeding and they have engorgement, ice could be a potential alternative and ease their pain a little bit more. So providing them with ice packs or those instructions would help. For a patient that has had vaginal tearing, the pads with the ice packs could ease that pain, and also making sure to keep that area nice and clean to prevent any further type of infection. The same would go for if they're having incisional pain from cesarean, just making sure that that area is kept nice and dry and clean so that there's no infection. Just looking at that area every day to make sure that there's no signs of redness or swelling. And then also they could do the same thing and apply heat or ice to that area. Another reason that they could be having potential pain is possible hemorrhoids from pushing during labor, and so they could use medicated wipes for that, or baby wipes. And they also need to make sure that they're looking for signs of resolution and making sure that pain is not getting worse and it's getting better. With hemorrhoids, positioning is something that is very important, so providing them with maybe like an inflatable donut for them to sit on so that they are not putting pressure directly on their bottom. But I think that that's the first step, just to establish what type of pain they're having and provide them with some alternatives so that they're not feeling like Motrin is their only answer. I think that lastly, what I would say is just making sure they know the signs and symptoms if the pain is not getting better with Motrin, what to escalate to the doctor so that they can help them ensure that there is no infection or something that's causing the pain to be worse. Thank you.